Walk with me as we take a broad-ranging tour of the world of cannabis, from the ancient to the modern, the medical to the recreational, as well as the social, cultural, and political landscapes of this fascinating plant. I am Dr. Jake Felice, and this is the Cannabis Matrix, where cannabis science meets cannabis culture, where recreational meets medical, and where the body's own endocannabinoid system is as much a player as CBD or THC. Welcome. Hey, and thank you so much for listening to the Cannabis Matrix Podcast. We have a super exciting topic today, cannabis and the opiate epidemic, how cannabis might be a helpful tool in reducing some of these thousands and thousands of deaths that Americans are having every year with the opiate crisis. So without further ado, I'm going to switch over to a PowerPoint format. You can view and listen along so that you can see the peer-reviewed references. Feel free to drop me a line and let me know if you like this format. I'm Dr. Jake Felice. You can find me at drjakefelice.com and at cannabismatrix.com. Also, feel free to click like and subscribe. I'd love to see more of you on my page. And again, thank you so much for listening. If we look at the data, it really does point to a fairly clear answer. This is an analysis of monthly opioid deaths in Colorado, starting from the turn of the century, the year 2000. And you can see that there's an upward slope all the way to the top. In 2014, there was recreational marijuana legalization in the state of Colorado, and we see an immediate downturn in opiate-related deaths. And we're going to look at the data as we roll through the slideshow here. Why is this important? Pain is huge. Over 100 million Americans suffer from chronic pain, and pain affects patients more patients than diabetes, heart disease, and cancer combined. It's enormous, and it's enormously expensive. Just the healthcare costs alone are over $500 billion, equaling about $2,000 per year for everyone living in the United States. Pain affects 1 in 5 Americans are losing sleep in any given week. And if we look at the tools that we have, this is from the World Health Organization, the step ladder for pain. This is our toolkit for pain. And most pharmaceutical or over-the-counter treatments don't provide enough relief for a large proportion of the population, and they can entail serious side effects. Our main tools are NSAIDs and opiates. Those are the big tools. And both of those classes have serious problems, which we'll talk a bit about here on the opiate side. So there's been this increase in opiate prescribing, but there has not been an increase in other types of pain medication. So doctors are prescribing more and more and more opiates, but not any other type of medications, statistically speaking. Clinical alternatives to prescription opiates I think are being underutilized, especially with cannabis as a means of treating ambulatory non-malignant pain. It not only costs money on the healthcare side, but people who are in pain don't work as well, and lost productive time due to pain costs U.S. companies over $60 billion a year. And make no mistake, if you have chronic pain, you know this, pain is stealing your time. And from society's perspective, it's also taking our money. Over half the workforce reports pain in the last week, and 12.5% of the people over the last 2 weeks are experiencing lost productive time due to pain, according to this study from the American Productivity Audit in the Journal of Occupational and Environmental Medicine. Unfortunately, doctors can be undereducated in terms of really understanding pain in their conventional Education curriculum. Vets, for example, veterinarians receive 4 to 5 times the number of education hours for pain treatment than conventional MDs. I think most docs are very much aware of the opiate crisis, the NSAID crisis, which I'll talk about in next week's podcast. We'll be talking about NSAIDs. But many doctors I know for sure are not aware of the scope of the NSAID problem. Pain is one of the big reasons that folks use medical cannabis. Over 300 studies, including 36 double-blind RCTs, which are one of the best types of studies, showing that cannabis does help patients with chronic pain. And there is a lot of evidence that that's the case. I don't think very many people are disputing that. One thing, if you look at the bottom of this slide, you can use cannabis in and along with the opiates. The cannabis actually can help the opiates work better. And we think that's one of the reasons that so many folks who utilize cannabis are reducing some of their pain-relieving medications. One thing that is important when we have pain and inflammation is that this receptor density that I talked about in the ECS podcast shift within tissues. So the endocannabinoid system is monitoring, adapting, and changing when there is a pain state or a pathological state. And I think that that's an important feature, is that this endocannabinoid system does a lot of things to help folks with pain in addition to just the anti-inflammatory effects. There are some withdrawal symptoms for cannabis. They're typically mild and are nothing resembling those of opiates withdrawal, which definitely can lead patients to death. In terms of cannabis toxicity, it's estimated that the average human would have to smoke 2,000 to 4,000 joints in 15 minutes to kill him or herself. That computes to over 150 pounds of cannabis in 15 minutes. It's very, very low toxic. Medical cannabis is extremely low toxic. And NSAIDs, on the other hand, not so low toxic. You can see here from this graph of U.S. mortality that there is a silent NSAID epidemic. So medications such as ibuprofen fall under that class, with just about as many people dying from NSAIDs as die from AIDS, for example, and even more people dying from NSAID toxicity than, say, conditions like multiple myeloma, asthma, cervical cancer, or Hodgkin's disease. And the adverse reactions are common with NSAIDs. 26 to 60% of patients taking NSAIDs have adverse reactions, and their use is increasing over time. I'll talk more about these statistics next week. Today, I want to focus on the opiates. To be clear, we are looking at correlational data, and what we need are prospective epidemiologic and clinical studies. We have a number of those in the pipeline, so hopefully we'll be getting a lot more information about this. That doesn't mean we don't have information, and that's what I'm here to talk about today. The number one cause of accidental death in the U.S. is death by prescription drugs, and the vast majority of those deaths, the most common, I should rather say, is respiratory depression, where literally under the influence of opiates, we forget to breathe. The nervous system does not remember to breathe when the opiates get to a certain level, and a lot of people die that way. It used to be that this was not the case, but nearly 80% of heroin users start with the pills, prescription opiates, before initiating heroin. It used to be the opposite. People would, in the past, would start with heroin and end up on the pills, but it's so much reversed right now. The vast majority of heroin users are starting with prescription opiates, and then when they can no longer fill those because they're abusing them, they switch to the street drug. The U.S., we use a lot of opiates. We consume 80% of the entire planet's opiates. So think about that in terms of the clinical management of pain. and we consume 99% of its hydrocodone. Again, this is a patented medication, and people are getting rich off of this medicine. States, when they permit medical marijuana dispensaries, will very quickly experience a decrease both in opiate addictions and opiate overdose deaths compared to states that are not. So it's not just that the deaths are going down, but the addictions are going down as well. Also, using cannabis together with opiates, I think, can for a lot of times be a good idea, and it does not appear to increase the risk of serious adverse effects or death when patients just use opiates alone. In fact, quite the opposite. I'll present some information here. The safety profile of cannabis, clearly superior to that of opiates, as well as the drugs used to treat opioid addiction. And with cannabis, there's no risk that the nervous system is going to forget to breathe, because we have such a small number of cannabinoid receptors located in the breathing and heart centers of our brainstem. Now, look at these graphs, and you can see a rapid increase in opiate overdose death rates, according to the CDC. From 1999 to 2016, over 630,000 people have died from drug overdose. Correct me if I'm wrong, you can ask Google, but I think that's more people more soldiers than were killed, U.S. soldiers than were killed in all of World War II. I believe that number is in and around 500,000. Now, if I'm wrong, that's the point is that it is an enormous number of people over the last 15, 20 years that have lost their lives. And recent data indicate that in 2015, prescription opioids and heroin killed more people than any year on record. So what can happen is patients can develop an addiction after that, and then they get removed from their pain program, and they go straight to the black market to obtain heroin, because they say that it's far more the prescription pills are far more expensive and more difficult to get than the street heroin. Now, this is a super interesting study. It is from the Morbidity and Mortality Weekly. And basically, if you are a patient who's never had opiates ever, and you go to your doctor and you get a 6-day prescription, the chance of you being on opiates a year later is over 1 in 10. So over 1 in 10 people who've never used opiates, who are given them for 6 days, boom, a year later, they're still using. Now, if that original prescription is for 2 weeks, it's not basically a 1 in 10, but it's more like almost a 1 in 4, nearly 1 in 4 patients for a 2-week prescription. A lot of folks will get a month-long opiate prescription. Those folks, nearly 1 in 3 of them, folks who have never used opiates before, nearly 1 in 3 of them a year later are still using opiates. And it's important to note that 7% of initial opiate prescriptions exceed a 30-day supply. Here's a graphical representation of that. The top line is the 1-year probability, and the bottom line is a 3-year probability. So we're talking about relatively short prescriptions to people who have never used opiates before. And if you look 3 years later, OMG, for folks with a very long prescription, almost 1 in 3 of them are using opiates 3 years later. Think about the bottom line for pharmaceutical companies with this model. Basically, you introduce a drug and people stay on it for a long time. What happens to them? Well, synthetic opiates, which are things like fentanyl, the deaths are steadily increasing. In 2010, there were about 3,000 deaths. 5 years later, that went up by over almost 17,000 people. So in nearly 5 years, that is over a quadrupling of the number of opioid-related deaths from synthetics. So it's going up and up and up and up. This is from the Annals of Surgery, peer-reviewed journal. Patients who get prescriptions for opiates before elective surgeries, they have longer hospital stays if you're doing opiates before surgery, and a higher chance of needing follow-up care in a hospital or a rehab facility than patients who are not taking the drugs before the same operations. This is from the same journal, different study. Opioid use is common before abdominopelvic surgery and is independently associated with post-healthcare utilization and morbidity. Basically, pre-operative opiates represent, according to these authors, a modifiable risk factor and a novel target to improve quality and value of surgical care. So it appears that there is a correlation between opiate use and ahead of surgery, and having a poorer outcome. Interestingly, I mentioned that cannabis and opiates can be used together. Cannabis will actually help opiates work better while at the same time decreasing their tolerance, and also cannabis will reduce side effects of opiate withdrawal. So if a patient decides they want to try to wean themselves off of the medication, cannabis can help reducing the nausea, that withdrawal, the muscle aches, the cramping, the anxiety, the depression. Also, in terms of pain, positive things interact, positive synergistic and additive interactions occur between cannabis and opiates, and that when used together, medical cannabis combined with opiates helps patients obtain better relief and helps patients for whom opiates have become ineffective due to tolerance. So if you're a patient and you're using more and more opiates to get the same amount of pain relief, you're developing tolerance. Cannabis can actually help reverse that. And also, cannabis can help prevent the development of this tolerance before it even happens. So if you've got tolerance, it can reverse it. And if you haven't developed tolerance, you're using cannabis in combination with opiates, it can prevent the development of opiate tolerance. If you can't read any of these citations, just email me, Dr. Jake at drjakefelice.com, and I'd be happy to send you the citations. Medical cannabis patients using opiates report a reduction in opiate doses. They're taking fewer opiates, and they're also having fewer opiate-related side effects, and most very importantly, increased quality of life, so that the cannabis patients who use opiates have a better quality of life. Wouldn't you want that? I certainly think that that's a great option for patients to have. Now, this is a very important statistics. U.S. states that have a medical cannabis laws have 25% fewer deaths from opiate overdoses. And also we have Medicare data that show that once a state starts a medical cannabis laws, prescription drug use falls significantly. There's a different study that shows that in states with legal cannabis access, there's 13% fewer hospitalizations. So the prior slide was talking about 25% fewer deaths. Here we have 13% fewer hospitalizations. Let me just make sure I'm reading this properly. 13% fewer opioid abuse-related hospitalizations and 23% fewer overdose-related hospitalizations. I think this is, for me, the most interesting slide in the presentation because what it says to me, the role of education and consumer awareness in a legal market. Reduction in opioid mortality generally strengthens over time once a medical cannabis law has been passed. So basically what's happening is that the population is getting more and more of an opiate reducing correlation. When the law is passed, over time, fewer and fewer people die. I think that one of the reasons this is happening is because the longer a law has been established, the more culturally acceptable it is, the more likely people are going to perhaps think that it might be a viable option for them, and the stigma perhaps decreases. But it's not just that once a law gets passed, it causes improvement, but that over time, that benefit gets better. Now, these are a list of medications that patients who are using cannabis will reduce. At the top, you can see that the narcotics and the opiates are super high, and that's super common. But there are also a bunch of other medications such as NSAIDs, sedatives, muscle relaxants, migraine medication. Patients are using fewer of all of these types of medications when they use medical cannabis. A recent study shows that over 2/3 of patients use cannabis to reduce their prescription drugs. And a different study here on the same slide, a survey study, indicates that about half are able to do that. And there's also some new research you can see here that demonstrates that medical cannabis patients also reduce other drugs that we consider dangerous, such as alcohol, opiates, and cocaine. So patients are not only just using fewer opiates, they're using less alcohol and less cocaine. Medical cannabis provides relief from opiate withdrawal symptoms. We know this objectively because there's something called the clinical opiate withdrawal scale, and we can measure the severity of opiate withdrawal, and so we know that it's not only just helping the pain aspect, but also on the withdrawal side. Medical, according to the authors of this study, quote, medical and adult use marijuana laws have the potential to lower opioid prescribing for Medicaid enrollees in this high-risk population that they looked at. And again, I mentioned that the most common prescription medications replaced by medical cannabis are opiates, and up to 72% of patients in the chronic pain group were able to do this. This is very notable, I think. I'm going to skip through a few slides here. Another study, 35.1% of folks reported decrease in their drugs of consumption, mainly pain relievers, which are analgesics, antipyretics, which reduce fever, as well as sedatives, steroids, and opiates. Opioids, for example, were the most prevalent drug consumed, and 36% of them were able to stop of the patients, and 10% were able to decrease. So that 36 plus 9.9 is nearly 50% of people are either reducing or eliminating their opiates with cannabis. Again, this is correlation, not causality, but we need more studies. Preclinical animal studies are showing that CBD reduces the reward properties of opiates and decreases heroin-seeking behaviors. Another small study in opiate addicts. This is a great study. One single dose of CBD reduces opiate cravings for 24 hours, with the effect lasting for 7 days, and also anxiety was reduced at this point in time. Here's a different study showing that participants who consume cannabis are significantly less likely to reinitiate opiate use during the treatment program. So if you get yourself into a treatment program and you're occasionally using cannabis medications, you're more likely to stay on track and not reinitiate the therapy. Also, this one study shows that not just in young, otherwise healthy people with pain, but also in folks who are over the age of 65 years old. The authors state that their study finds that therapeutic use of cannabis is safe and efficacious in the elderly population. largely because cannabis use may decrease the use of opiates and other prescription medication. I think that's cool. This is a great study because it points towards that synergy effect. You can use a small dose of oxycodone, which 2.5 milligrams in these patients was not eliciting pain relief. But if you combine it with tolerance, an ineffective dose of the opiate with the cannabis all of a sudden becomes effective. So it's pointing to additive and synergistic effects with opiates. Here's another study, small study, 21 people in chronic pain who are taking sustained release morphine or oxycodone twice a day, and vaporized cannabis was shown to improve the pain relieving effect of the opiates without altering their plasma levels. So I think that this points to a possibility for good combination, and we're going to be having hopefully more clinical trials on this soon. Different study, 44% patients were able to discontinue opiates entirely. This is really important. Opiate use is not correlated with increased better health-related quality of life. If you are using opiates for your pain, your life's not going to get better, basically is what this is saying. That's the opposite of some of the cannabis data. Here we see that cannabis use, this study is very interesting because it contradicts a lot of the information that I have been talking about. Cannabis use appears to increase rather than decrease the use of developing non-medical opioid use disorder. What do you think's going on there? If you look at the years 2001 and 2004, this was black market sourced cannabis. And what happens when you buy on the black market as you are exposed to social pressures that are not present when there's a brick and mortar store? So if you are seeing indications that cannabis use might increase opiates, just look at the year that the data was collected. And if the data was collected in the early 2000s, not very many states had legal laws at that point in time. So the point and the thrust of I think the literature here, the scientific literature, is showing that laws do make a difference. Levels of depression and anxiety are higher among chronic pain patients receiving chronic opioids compared to medical marijuana. So more anxiety with opiate patients versus patients using medical cannabis. And I think that as clinicians, we should take this into consideration when we are deciding the most appropriate modes of treatment for our patients. Again, here's probably a better way to say that. Levels of depression and anxiety are higher among chronic pain patients receiving prescription opioids compared to those receiving medical marijuana. And I'm almost done, but this is the real key to all of it. Restored Self, a phenomenologic study of pain relief by cannabis. This is from the journal Pain Medicine. And basically what patients say, and this is what I love to hear, is they say these words: I feel like myself again. And we have it documented here in the literature. A pain patient who's had chronic pain for years, if not decades, when introduced to medical cannabis, a lot of them will say these things. Clinically, I can tell you, they say this: I feel like myself again. And I think that that's a beautiful thing. Medical cannabis does have a role to play in chronic pain. And I have a lot more to say about this in the future, but for now, I thank you for listening. This is Dr. Jake Felice with the Cannabis Matrix, and I really appreciate you guys being here. Thank you and take care.
Well, it was in my childhood days